it should not be lost on us that this is HR1964. In a real sense, this is the new civil rights struggle. Let there be no mistake that if the number one killer of white women of childbearing age was HIV/AIDS, we would have had this done a long time ago. And so HIV/AIDS is a civil rights issue, and we're here because we're committed both on the side of personal responsibility and public policy. We have to have both of those things. And so I say to the congresspersons who are gathered here that we have been clear voices in our own context from all of the states that you see represented here. I stood in the pulpit of the Ebenezer Baptist Church in Atlanta this past Sunday, Congressman Cummings, and did the same thing I did in Baltimore. Took an HIV/AIDS test. This time I did it in the middle of worship. Because desperate times require us to step outside of the box and recognize that we cannot continue business as usual. And so I took that test, and it got some attention, and we went on the news programs to talk about this. But then when I was doing an interview just 2 days ago on one of the local stations, I was with a young woman who works for one of our community-based organizations, Aid Atlanta. And she said to me to tell the congresspersons gathered here that they have more people waiting to be tested in her agency than they have resources to test them. And so one of the tremendous things about HR 1964 is that it emphasizes enhanced testing, particularly in the African American community, among homeless youth, among youth in foster care. And so we support health care reform, but there are some parts of health care reform, or there are some parts of this bill, HR 1964, that are not covered in the health care reform bill. And so we need resources, but we also need to address in a strategic way the kinds of public policy issues that will make testing, for example, routine. That when you go to your doctor, routine testing. It takes resources for that to happen. A kind of media campaign that targets the African American community. Nearly 30 years into this epidemic, our numbers are still climbing. And so we need a piece of legislation that addresses the disproportionate impact of this virus in the African American community. We need your support. We're grateful that you are here. Thank you so much.